All right, module 8 now, dysrhythmias. Now, to keep our knowledge on arrhythmias simple, just enough to meet minimum NCLEX requirements, because this will be, in order for you to become proficient at reading rhythms, it takes practice. Obviously, we don't have that luxury unless you do this at work, but for NCLEX purposes, you're only going to be tested on basic dysrhythmias, okay? Commonly occurring dysrhythmias. And to be fair as well, because again, not all of you will have experience with reading rhythms. So I will only be using the strips, the cardiac rhythm strips that are available in your textbook. Okay. And then we will be answering one of 5 questions on your exams, both for exam 3 and or the final exam. They are: number 1, what does the rhythm look like? Number 2, what are the possible causes? Because when you know the causes, then you know how to either eliminate or prevent the abnormal rhythm. Number 3, signs and symptoms. The beauty about signs and symptoms is there are no arrhythmias that will increase cardiac output. Either they are harmless or they will drop cardiac output. Okay, so either the patient will be asymptomatic or the patient will have signs and symptoms of decreased cardiac output, which we already know from heart failure. Yeah, which are basically signs and symptoms of sympathetic stimulation. You remember? Okay. Number 4 are the interventions. What can we do about the rhythm? Some rhythms need interventions, some do not. Number 5, what is your patient teaching? Now, teaching will be either from the drugs that they'll be taking and or preventing the abnormal rhythm, or what to do when they're experiencing it. Any questions? Okay, so however many strips there are on this chapter times 5 questions. So those are your possible questions on your exam 3 as well as the final. All right. Again, only keep it to the strips that are available in your textbook. If a rhythm does not have a represented rhythm strip on your textbook, then there will be no rhythm on that particular arrhythmia, okay, on your tests. You follow? Okay. All right, let's begin. And keep in mind, exam 3 is not all about dysrhythmias. So this is just one part of the whole exam. Okay, so this will probably have 12 questions. That's it. And then the other questions will be on other topics, all right, on other modules. Okay, let's look at normal cardiac conduction first. Now, what makes the heart very unique is, unlike skeletal muscles, which rely on nerve stimulation in order to function, the heart can generate its own electrical impulses. It can therefore work separately from the CNS, although it can be influenced by CNS factors. However, it does not need the CNS in order to perform its function, okay, unlike skeletal muscles. So let's say if you have a stroke, can your muscles still perform?
I mean, yeah, technically, yeah, but
Well,
you
the
can't move.
affected sides, though, let's say you had, okay, so that's my point. Okay. So let's say another example is after spinal cord injury. Will your muscles still work below the level of injury?
No,
Okay, again, I've proven my point. However, in heart attack, in a stroke or spinal cord injury, will the heart stop pumping? No, it will continue to work regardless of what's happening in your spinal cord or your CNS systems. Does that make sense? Okay, so it can generate its own electrical impulse, but again, it can be influenced. Okay, or by the stroke, in a stroke or any CNS problems or any spinal cord problems. However, again, it doesn't need to. Okay, it doesn't need to be stimulated. It can generate its own electrical impulse. So in order for the heart to work, it needs to initiate an electrical impulse. We have three pacemakers of the heart. Pacemakers are specialized cells in the heart that are capable of generating an electrical impulse and stimulating the rest of the organ. The primary pacemaker is the SA node. This is located near the superior vena cava inside the right atrium. So this is our primary pacemaker. It's capable of firing 60 to 100 beats a minute, so which coincides with the normal heartbeat, yeah? So normal heart rate is between 60 to 100. So that is made possible by your SA node or the sinoatrial node. The secondary pacemaker is called the AV node, or also called the atrioventricular node. By its name, it's located between the atria and the ventricles. I'll show you a picture shortly. This is still a pacemaker. However, it's only a backup pacemaker. Unlike the SA node, which is capable of firing 60 to 100 electrical impulses, the AV node is only capable of 40 to 60 per minute. So yes, it can sustain life, but not primarily. Okay. Finally, there's a third set of pacemakers. They are the bundle of His and the Purkinje fibers. So here's a picture. The SA node is right there on the superior vena cava by the right atrium. And then the AV node, as already mentioned, is between the atria and the ventricles, right near the septum. And then you have the left and right bundle branches, and the pacemakers end at the Purkinje fibers, which are toward the end of the ventricles, both on the right and left sides. Okay. Now, as I mentioned, the bundle of His all the way to the Purkinje fibers are pacemakers themselves as well. However, because they can only generate between 20 and 40 beats per minute, they are not reliable they can't be relied upon to sustain life. I mean, can you live with a heartbeat of 20 to 40? All right, so it's negligible, really. So we're only basically talking about the SA node and the AV node. All right, so because the Purkinje fibers as pacemakers are basically useless. The left and right bundle of His, these two bundle branches, all the way to the Purkinje fibers. Please always refer to your textbook so you can follow along the lesson. Okay. All right. All right. So let's look at what the waves represent. So we'll look at an animation. So we have one cardiac cycle here. This is one heartbeat. There's a series of waves and complexes, which you'll see on graphs. You've seen this in movies. Okay, you've seen these in pictures. So there are different waves and complexes representing phases of the cardiac cycle. So one heartbeat is the contraction of the atria and the ventricles. That is one heartbeat. If we were to illustrate that in an electrical pathway or an electrical illustration, this is what it looks like. So this is the P wave. This is the Q wave. That's the R wave. This is the S wave. This is what we call the ST segment. And then we have the T wave. And we also have the PR interval, which is kind of confusing because the PR interval does not include the R wave. So the PR interval is from the beginning of the P to right before the Q wave begins. Okay, we'll look at more explanation about these waves and complexes by watching a short video.
The cardiac conduction system consists of the following components: the sinoatrial node, or SA node, located in the right atrium near the entrance of the superior vena cava.
Okay, so as you saw in that animation, the SA node fired. Let me back up a little bit. So watch as the SA node fires an electrical impulse and watch where the electrical impulse moves. Okay, as you can see, one electrical impulse, it spread throughout both atria.
SA node spread throughout both atria and stimulate them to contract. The atrioventricular node, or AV node, located on the other side of the right atrium near the AV valve. The AV node serves as electrical or AV node.
Okay, so it's an electrical impulse. So therefore, does it take long or really quickly to reach somewhere? Just like lightning, for instance, when you see lightning appear in the sky, did it take long for it to hit something over the horizon? No, it was over before you knew it, right? So same thing here. So when the electrical impulse was generated by the SA node, yes, it spread to the left atrium and then causing both atria to contract exactly at the same time. The electrical impulse reached the AV node. However, the AV node did not transmit the impulse, the electrical impulse, down to the bundle, left and right bundle branches and the Purkinje fibers. It waited between 0.12 to 0.2 seconds. Now that delay, that delay in the impulse transmission is necessary for blood to move from the atria down to both ventricles before the electrical impulse is passed down to the ventricles and then causing the ventricles to contract. Because if we would allow it to transmit instantaneously without that delay, what will happen to atrial and ventricular contraction? The timing, what will happen to the timing? They will contract at exactly the same time. Okay, so is the delay necessary?
Yes.
Yes, the delay is crucial. The delay is vital for cardiac output to be possible. Okay, so the delay is represented by the PR
on the other side of the right atrium near the AV valve.
So the delay in the impulse transmission made possible by the AV node. So when the electrical impulse reached the AV node knows not to transmit it immediately. So again, it will delay the impulse transmission between 0.12 to 0.2 seconds, okay, before transmission is passed down to the ventricles.
The AV node serves as electrical gateway to the ventricles. It delays the passage of electrical impulses to the ventricle. This delay is to ensure that the atria have ejected all the blood into the ventricles before the ventricles contract. The AV node receives signals from the SA node and passes them onto the atrioventricular bundle, AV bundle, or bundle of His. This bundle is then divided into right and left bundle branches, which conduct the impulses toward the apex of the heart. The signals are then passed onto Purkinje fibers, turning upward and spreading throughout the ventricular myocardium. Electrical activities of the heart can be recorded in the form of electrocardiogram, ECG, or EKG. An ECG is a composite recording of all the action potentials produced by the nodes and the cells of the myocardium. Each wave or segment of the ECG corresponds to a certain event of the cardiac electrical cycle. When the atria are full of blood, the SA node fires, electrical signals spread throughout the atria and cause them to depolarize. This is represented by the P wave on the ECG. Atrial contraction or atrial systole starts about 100 milliseconds after the P wave begins. The PQ segment represents the time the signal travels from the SA node to the AV node. The QRS complex marks the firing of the AV node and represents ventricular depolarization. Q wave corresponds to depolarization of the interventricular septum. R wave is produced by depolarization of the main mass of the ventricles. S wave represents the last phase of ventricular depolarization at the base of the heart. Atrial repolarization also occurs during this time, but the signal is obscured by the large QRS complex. The ST segment reflects the plateau in the myocardial action potential. This is when the ventricles contract and pump blood. The T wave represents ventricular repolarization immediately before ventricular relaxation, or ventricular diastole. The cycle repeats itself with every heartbeat.
All right, I hope that helped a little bit.
What's the name of that page, the YouTube page? Yeah, what is this?
I just searched cardiac conduction system and understanding ECG animation. Just look for Alila Medical Media. Alila, but you can look at any animation. I just chose that one because it was short and direct to the point. All right, back here. So let's explain the illustration. So the electrical activity of the heart can be recorded on an ECG paper. This was invented by Dr. Einthoven. He invented the ECG machine. The picture you saw earlier, this triangle here, this upside down triangle, is called the Einthoven triangle. This is not testable. Let me just explain to you in the simplest terms I know what you're looking at. So because the ECG machine has a 12-lead ECG has 10 electrodes, and out of these 10 electrodes, there are 2 bipolar leads, meaning electrodes are either positive or negative charge, correct? Now, there are 2 bipolar leads. You can see here the left shoulder or the left arm lead is bipolar. You see both a positive and a negative lead there. And then as well as also the, it's not illustrated here, but the relationship between the right and left shoulders interact to give you 2 views. Okay? I don't know if that's clear as mud, but think of a 12-lead ECG as 12 different photographers looking at the heart at different angles. They're looking at the same heartbeat, the same electrical impulse. However, they're looking at it from different angles. So that's why they look different. We don't have a 12-lead ECG reading on your textbook, so let's look online. So here's an example of a 12-lead ECG. Okay. So you have here lead 1, 2, 3, AVR, AVL, AVF. AVF is the left foot. Okay. Then we got V1, 2, 3, 4, 5, 6. That's total of 12, right? So this is the same heart, the same electrical activity that the ECG is reading. This is the same patient. However, if you look at the readings, they all look different. Yeah, depending on where are you looking at the electrical activity from. Are you looking at it from lead 1, lead 2, or are you looking at it from V1 or V6 or from AVR? All right. Now, how is this relevant? Now, looking at the leads, they pertain to a different angle. So therefore, it can either be looking at the top, the side, when we say side, it's either the left side or the right side of the heart. It could also be at the apex of the heart, meaning which is the lower part of the heart. And you can also look at it from the posterior part. So looking at the changes for example, where is the abnormality seen? In which wave is it appearing? That helps the doctor diagnose which coronary artery is affected. Does that make sense? Okay. Again, we are nurses. If you want to go into detailed electrophysiology, yes, you're welcome to. You can become a nurse practitioner, for instance, and then specialize in reading ECGs. All right. On the NCLEX, you may be asked to place a 12-lead ECG on a patient to get a reading. So this is the placement of the leads. Now again, a 12-lead ECG has 12 views, but we literally only have 10 electrodes, right? And this is the placement of the electrodes. There'll be one on each limb. It's easy to see because they're clearly marked. Right arm, right leg, left leg. The chest leads, there are 6 chest leads. This is the placement of the chest leads. We got V1, V2 will be in the second intercostal sternal border, and then V3 will be on the third intercostal left sternal border, and then 4, 5, and 6 will be on the between the 4th and 5th, all the way. V6 will be all the way to the mid-axillary line, whereas 5 is right around the nipple area, which is mid-axillary. Mid-clavicular area. So therefore you have your 10 electrodes. Okay, so just in case you get a question, a hotspot question, that's where you place the electrodes. Are we clear? Any question? All right. Okay, let's review again what each wave and complex represent. As shown in the video, when you see a P wave, this is the P wave right here. P wave. What does it represent? There are 2 points of significance for seeing a P wave. Number 1, we know that the electrical impulse came from the atrial node, the sinoatrial node, the primary pacemaker. If we don't see a P wave, what does that mean, therefore? If there are no P waves? Let me repeat. When you see a P wave, that means one of 2 things. 1, The electrical impulse was generated by the SA node, and it caused the atria to contract. That's if you see a P wave. So if you don't see a P wave, what two things are not present? The atria did not contract and the impulse did not come from the SA node. Are we clear? Meaning that heartbeat was possible, but where did it come from? Nobody knows. Okay, but we know it did not come from the SA node. Does that make sense? So is a P wave important? Yes, we should see a P wave on every heartbeat. You have a question? You seem to be frowning, Mr. Valadares.
But where does it come from? I was confused with that one.
Okay, so if there are no P waves, usually it came from where? We don't know. Okay, in order for us to find out where the electrical impulse came from, patient has to go down to the electrophysiology unit to find out. We don't know. We don't know. There are some cells, we know some other cells were firing them, but it wasn't the SA node. Are we clear? All right. So this is the problem with rhythms like atrial fibrillation, atrial flutter, right? Meaning there are no P waves in those rhythms. Hey, you do not see a P wave. So two things did not happen if you don't see a P wave. What are those two things again? SA node fired the impulse and the atria contracted. So if no P waves, what two things did not happen? The SA node did not fire that impulse and the atria did not really contract. They did something, but it wasn't a contraction.
It wasn't like recorded.
It wasn't a true contraction.
Oh, okay.
For a contraction to be complete, there has to be a P wave, meaning atrial contraction, right? Again, no P wave. What two things did not happen? The impulse did not come from the SA node and the atria did not really contract. Okay? They did something, maybe quiver, but did not really contract. So if it did not contract, did blood really move out of the atria? Not really. Okay. Is that dangerous? Yes, that means blood is pooling in the atria because they're not completely emptying. Next wave, the QRS complex. So this is the biggest set of waves in your ECG. So the QRS here. So, oh, by the way, the paper, the ECG paper, what you're looking at are a bunch of horizontal and vertical lines, correct? Okay. So they have a significance. So the vertical lines measure millivolts. So they measure voltage. Okay, how strong is the contraction? This is again in millivolts. So here, for example, you see there are small and big boxes, yeah? So these are small, tiny boxes, and you notice that they're in a 25 set of small boxes. That's one big box. You notice that? So here you have small boxes, then you have one big box. So these are small boxes right here. And if you count one big box, there are 25 small boxes in there. 1, 2, 3, 4, 5 times 1, 2, 3, 4, 5. So that's 25. Okay. So that's the vertical axis, millivolts. So one big box is 0.5 millivolts. And then the horizontal line is time in seconds. Each tiny little box is 0.04 seconds. So therefore, one big box, which has 5, 1, 2, 3, 4, 5 times 0.04 equals 0.2 seconds. So therefore, 1 second is how many big boxes? 5, correct? Yeah, 5 times 0.2 equals 1. You follow so far? Okay, so we'll look at it later because we're going to measure the waves and complexes a little bit later. So the QRS complex is here. Look, it's at least 1.5 big box, okay, in height, and then it's also its width is about, see, it's less than 2 small boxes, right? So therefore it's about 0.1 to 0.12 seconds, okay, because it's less than or equal to 2 small boxes, okay? So that's how wide they should be. Should only be 0.1 or 0.12 seconds in duration. The next wave is the PR interval. Like I said here earlier, the PR interval does not include the R. The PR interval is actually from the P wave down to the beginning of the Q. Notice that we measure and identify each wave based on a certain imaginary line, a certain imaginary horizontal line. Now, in this particular figure, this figure 22-3, this is drawn, okay, by an artist. It's not a real ECG tracing. Okay, so when it's drawn by an artist, of course, it looks perfect. Yeah, it starts and ends on a solid horizontal line. But on a real ECG reading, they never fall on a solid line. They fall somewhere in between, like some random area along the paper. But even in, I show you an example. In here, for example, so this is an actual reading. You can see here that it's sorry, I messed it up. You can see that it doesn't really fall on a solid line. However, you can see a imaginary isoelectric line. Isoelectric line meaning it's a flat line, okay, from which each wave seems to start and end at the same isoelectric line. Does that make sense? Meaning you can draw a straight line, an imaginary line along a reading, and notice that each wave and complex leaves and returns to the same isoelectric line. It works better if you have your own textbook. It's not very clear here. Are you following? Okay. I repeat, the PR interval is here. So what does the PR interval represent again? So we know the P wave is when the atria contracted, yeah? And then where did the impulse come from? The SA node, okay. So what is this distance therefore, this duration from when the P wave started to right before the QRS complex is when the ventricles contracted. So what is therefore represented by the PQ, or the official name is PR interval. So what can you best describe this period of time? This period of time includes the time it took for atria to contract, and then the time it took before the ventricles contracted. Yeah, because it started from here up to here. And then we know the ventricles started contracting right here. When the Q began to form, the R and then the S. This is the ventricular contraction period. So what can you best describe the PR interval period? For the time that the impulse was generated by the SA node, correct? Up until the when the AV node transmitted it. Because we know the AV node received the electrical impulse, but what did the AV node do? Did it transmit it directly? No, it delayed the impulse transmission. Okay, so it held on to the impulse for how long again? 0.12 to 0.2 seconds. So how many small boxes is that? 0.12 is 3, correct? And 0.2 is 5. So therefore, the duration of the PR interval is anywhere between 3 to 5 small boxes. So let's count if this is really 3 to 5 small boxes. So we start counting from here. This is half of a small box. So therefore, this is 1, 2, 3. 3.5 small boxes. Is that within that normal measurement? Yes, 0.12 to 0.2, which is 3 to 5 small boxes. Okay. So that's the PR interval. Then again, we have the QRS complex, which should be less than 2 small boxes. And then the ST segment should be isoelectric, meaning nothing should be happening, meaning not that nothing's happening. There is no electrical impulse during the ST segment, because what is the ST segment? I mean, the ST segment or ST interval representing again? The answer is here. So what is the ST segment? Represents early ventricular repolarization, because what will represent the actual ventricular repolarization? The T wave. Right here, the T wave. Okay. By the way, do you know what depolarization and repolarization means?
Resting and working.
Okay, correct. So let's say this is a cell. Okay, this is a cardiac cell. If it's resting, it is full of negatively charged ions, meaning, is it going to contract? No, because it is a resting cell. However, as the calcium-sodium channels close and open, allowing those positive and negatively charged particles to come in and out, will it generate power? Will it generate electricity? When it's busy, when positive and negative particles enter and leave the cell, is it generating electricity? Yes. Okay. Whereas if it's all negative, is it doing anything? No, it's resting, right? Okay, so therefore, as the cell becomes more and more positively charged, what will it do to all that energy? It will discharge it in the form of contraction, all right? So that's depolarization. Repolarization is when it's starts from a resting phase, which is negative, and then becomes more and more positively charged. Okay, so that's what we call repolarization. And then once it's ready for the next action potential, because it's all positively charged now, then it will discharge all that energy, allowing depolarization to be possible. You follow? All right. We don't really need to know the U wave, because the U wave is very seldom seen. In a typical ECG reading of probably 9 out of 10 patients, you won't see a U wave. Okay, U wave are usually seen only in potassium abnormalities, for instance, with hypokalemia, for instance. That's when you see a U wave, and they sometimes can be mistaken for a T wave, right? But it's not really a T wave. Okay, it looks like an extra T wave, right? That's a U wave, but again, it's very seldom seen. They don't typically appear on a normal ECG. You follow? So any questions about what you're looking at here? So let's review. In a typical heartbeat, what is happening when you see the P wave?
Let's see.
Okay, very good. What is happening when you see the QRS complex?
Beginning ventricular depolarization.
That's ventricular contraction or ventricular depolarization. What's happening in the T wave? Okay, the ventricles are repolarizing, getting ready for the next contraction. Okay, and as the video stated, the P wave, the atria, if the atria depolarize during the P wave, that means it has to repolarize at some point. Yeah, so it must be repolarizing around the same time as the QRS complex is happening. All right, because that's about the same interval. And then what's the significance of the PR interval again? Here, from the P to the Q wave. What's the significance of the PR interval?
Time between the atrial and ventricle contraction.
Okay, so this is the delay, right? So the delay by the AV node of transmitting the same electrical impulse. And what is the significance of the ST segment? Why is it flat?
Beginning the T wave.
This is early ventricular repolarization, meaning if you're ever wondering, does the heart ever rest? That's it. So the heart rests about 0.04 seconds between heartbeats. It does rest. That's basically it. So what is it doing while it's resting? It's actually getting ready for the next heartbeat. Okay, so your poor heart. No rest for your heart. Oh, actually, technically there is, right? How long does it rest? 0.04 seconds. Okay, let's analyze the rhythm strip now. First step will be to determine the heart rate. There are a few methods to determine the heart rate. Okay, let's go back to the previous page. Then we'll come back here. Here's our ECG paper again. So what does each small box represent again? 0.04 seconds. So therefore, 5 small boxes, which is 1 big box, is how long? 0.2 seconds. That means if 1 small box is 0.04 seconds, how many small boxes are there in 1 minute? Because we need to count the heart rate by beats per minute, correct? Okay, so we need to look at how many of these will be seen in 1 minute. So 0.04, divide that into 60 equals what? There are 1,500 small boxes in 1 minute. What about big boxes? 1 big box measures how much? 1 big box, the box here is how many seconds?
25.
No, 1 here, this horizontal line is time, right? So we don't count the vertical. So how many small boxes in 1 big box horizontally? 5. So 0.4 plus 0.4 plus 0.4 plus 0.4 plus 0.4 equals 0.2. Okay. So if 1 big box is 0.2 seconds, how many big boxes are there in 60 seconds? 300. Very good. So we know there are 1,500 small boxes in 1 minute, and there are how many big boxes? 300. Okay, so we'll use that as a way to count somebody's heart rate. The easiest easiest method to use according to your textbook is the R to R method, or you can simply count the number of beats in a 6-second strip. Now, why a 6-second strip? Because is it practical to print a 1-minute strip? Can we print a 1-minute strip and then expect to yeah. It's hard, right? Because it'll be very long. So a 6-second strip is about this long. So imagine how long a 60-second strip will be. So I need 10 of these. Do I have room on my towel? Do I have the whole table at the nurse's station? No, there are other people using the table. So I can't be, excuse me. Okay, it's not practical. So we will count only a 6-second strip, which times 10, whatever you get, times 10 equals your rate per minute. Okay, so it's a nice number. So we'll use a 6-second strip. How do we know it's a 6-second strip? The strips usually have a marker, a 3-second marker. This sample doesn't have one, but there will be solid lines every few big boxes. You can also easily see how many big boxes again in 1 second.
5.
Okay, so therefore every 5th box is 1 second. Okay, so therefore 1, 2, 3. Does anybody have a marker? Yellow. You have a dry erase marker, right?
No. I don't think it-
Yes, you do. The one you took from work.
I have.
Ah, took that from your work.
Always. Hold on.
Okay, so therefore, let's count here. So we need how many big boxes to make 3 seconds? Thank you. How many big boxes to make 3 seconds? Because we need to make 3-second markers. Okay, let's start with this simple. How many big boxes in 1 second?
Oh.
Okay, how long is 1 big box? This is a big box. In it are 5 small boxes. Okay, so this is 1 big box. So how many of these make 1 second? Each big box is 0.2 seconds. So how many big boxes to make 1 second? How is it 10? 1 second.
Oh.
If 1 big box is 0.2 seconds, how many to make 1 second?
30.
No. 1 divided by 0.2 equals how many? 5, right? Okay, so 1, 2, 3, 4, 5, that's 1 second. 1, 2, 3, 4, 5, that's 2 seconds. 1, 2, 3, 4, 5, that's 3 seconds. So here's our 3-second marker. All right, you follow now? Okay, so let's make another 3-second marker to make 6 seconds. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. That's 6 seconds, yeah? Okay, so from here to here is 6 seconds. Okay. Now let's count. To estimate this heart rate, let's use the easiest method. What represents 1 heartbeat? How do we know 1 heartbeat? P to S. Again, do we see a U wave all the time? No, we don't see a U wave all the time. So what is one heartbeat? Is a U wave part of a heartbeat? A normal heartbeat? No, U waves appear only during when? You have hypokalemia, when you have those problems. So is it part of the cardiac cycle? No. So a cardiac cycle only has what waves? A P, Q, R, S, and a T wave. Okay. So this is one heartbeat. One P to the T. That's one heartbeat. So how many do you see in this 6-second marker right here? How many heartbeats do you see? Do I count this one?
10. No. Yes, it's a part of the.
Is this a complete heartbeat?
No.
No, it's missing what? It's missing a P wave. So can I count this one? Okay, 1, 2, 3, 4, 5, 6, 7, 8. So is this heartbeat 80? Because I multiply this by 10, right?
Yeah.
6 times 10 equals 60 seconds.
Mhm.
So is it 80?
Yes.
Is it exactly 80?
One is.
Correct. Why is it not exactly 80?
Because the last.
Is there's part of a heartbeat here. Very good. You follow? So I know this is 80 something, right?
Mhm.
So on a test question, if I give you this strip and I ask you estimate the heartbeat. Now you're free to use whatever method you want. So this is one suggestion made by the textbook. You count how many heartbeats, okay, and then multiply and a 6-second strip and then multiply by 10. There's your estimated heartbeat. You follow? Okay. Another method is you're going to count. Let's use a different because this is too small. I want to see these small boxes.
This. In big part, like that's. Leave consent.
Yeah, let's try this one. So here you can see small boxes and big boxes, yeah? Yes or no?
Yeah.
Yes. Okay. So there's no 6-second marker, so we're gonna have to make our own 6-second marker. So 1, 2, 3, 4, 5, 1 second. 1, 2, 3, 4, 5, 2 seconds. 1, 2, 3, 4, 5, 3 seconds. So we don't even have enough. So bad example. Let's go back to our previous page. Maybe we can do something. With this strip. Okay. So this will work. Didn't know I could zoom. Okay. So now you see small boxes and big boxes, yeah? Yes or no? Okay. All right, let's see. So let's do our markers again. Our 6-second, our 3-second markers. So 1, 2, 3, 4, 5. 1 second. 1, 2, 3, 5, 2, 2, 3, 4, 5, 3. And that's the first 3-second marker. 1, 2, 3, 4, 5. 2, 3, 4, 5. 2, 5. Okay, so that's 6 seconds, yeah? Okay, so we're going to count from there. So earlier, this was the example we used. We counted 80 something, correct? Okay. But there are 8, and then because of this one. Now, the second method is you can also count how many R waves. We use R because R's are nice and pointy, yeah? But you can also use T wave or P wave, whichever one you prefer. But most people count R's, right? Because it's easy. It's easy to spot an R. All right. So how many small boxes in 1 minute again? 1 minute. How many small boxes in 1 minute? You gave me the answer earlier.
1,500.
1,500. And how many big boxes in 1 minute? 300. All right, so let's count the number of small boxes or big boxes between two R waves. Which two R's do you want? You pick any. Antonio, pick two R waves. So this is R wave number 1, 2,
So right there,
Three.
1, 2.
4, 5, 6, 7, 8, 9. So which or 10? Which two R waves do you want to count?
2 and
Or do you want to measure? 2 and 3?
Yeah.
Okay. So between this R and this R, how many small boxes do you see? Okay, so we know there are 5 in each big box, right? So I'll go 5, 10, 15. Yeah, plus how many big small boxes do you see here?
1 or 2.
It's not really one because it's way past that line there. So the R fell on between these two. So there's 1.5 there, right?
Okay.
1.5. How about this one? Is this mapped on a solid line also? No, right? So there's about half of a small box there and then another half here, correct?
Okay.
Okay, so another half. So therefore 5, 10, 15, 20, 16, 17, yeah, plus about 18, yeah? Okay, so 18, divide that into how many small boxes again? 1,500. So what do you got? Calculators? No, 1,500 divide that by 18, meaning divide 18 into 1,500. There are 1,500 small boxes. 83. So what was our estimate earlier again, using the method of counting? 80 something, yeah? So is this the same? Okay, all right, so let's see if the method still applies. Whichever one we use. So pick Miss Nelberg. Pick another two R's.
5 and 6.
Okay, let's try 5 and 6R. This time we'll use big boxes. How many big boxes do you see between these two R's? Not really, 'cause this is 1, 2, 3. Is this one big box?
No.
This is what? 3.1.
3.5.
Not really 3.5. Because 3.5 would be right here in the middle. It's not. It's right here on the second one. So that was about, what's that about? 3 points. So this is 0.5. So this must be 0.6, yeah? Okay, so let's say 0.6. 3.6. Divide that into how many? How many big boxes in 1 minute? 300. How many did we say? 3.6.
3.6.
Okay, let's try 3.6.
Eight, 3.
Hmm?
0.0.
No. You're doing it the other way. There's 300.
It's 83.
What do you get?
83.
So is it about the same? Okay. What can you say therefore in counting the heart rate? You can use, okay, you can use any method you want. However, this style of counting the heart rate will only be applicable if the rhythm is regular. What do I mean by a regular rhythm? This means that each wave and complex is occurring about the same time every time. So let's see, from this peak to that peak, is it occurring about the same? So let's look at the next P to P.
Yes.
Is it about the same?
Yeah.
Is it about the same? About the same? Okay, so let's say, okay, so we assume it's going to be the same all throughout there. Let's look at the two R's. okay, or the two T's, from one T to the next T, or from one R to the next R, is it occurring about the same time?
Yes.
Yes, it is. So therefore, is this a regular rhythm?
Yeah.
Yes, so you can use these three methods to count a rhythm like this one. It's easy. However, if you have an irregular rhythm, okay, can you use these methods easily?
No.
No. Plus, remember, these are estimates, right? Because the only true accurate measure of a heart rate is if you print a whole 60-second strip. Right? That's the most accurate. However, because if your rhythm is abnormal, meaning it doesn't occur like this, okay, so you have an abnormal rhythm, such as in in AFib, for instance, or an A flutter. Okay, you don't have a regular rhythm, meaning they don't occur at regular intervals. Your heart rate is going to be an estimate anyway, because from this minute to the next minute, is the heart rate going to be the same? An irregular heart rate. It's not going to be the same anyway. Okay, so all of these again are these accurate measurements?
That's
No.
Yeah, these are all estimates. Okay, are we clear? All right, but did we accomplish our goal of counting the heart rate? Yes, because that is the first step. Because once we know the heart rate, can we tell what type of rhythm it is? Yes, we have achieved the first step. Okay, let's continue next week. We don't have time anymore. So we finish counting the heart rate. So next week we'll look at other steps in order to determine a